Welcome back. It is OCD Awareness Week this week, and Ann Parpus and Jessica Good with Integrated Health Services join us live for a chat around OCD, why it's important for folks to know exactly what it is and how you might be able to get some help. So thank you, ladies, for being here. We really appreciate your time this morning. Let's start with what OCD is and what it isn't. Can you kind of detail what people should know about OCD?
Yeah, OCD is a mental health condition that has two core symptoms: obsessions that are intrusive, unwanted, intrusive thoughts, images, urges, feelings, sensations that cause significant anxiety, and then compulsions. And the compulsions are repetitive behaviors and or mental rituals that happen or are performed because of the anxiety of the obsession. And this cycle of obsessive and compulsive cycle, it can be very debilitating and take people away from being able to engage in their values and engage with things that matter most to them from day to day.
Yeah, it can be a big hindrance for many people who live with this condition. So I guess this week you guys are focusing on OCD awareness. That is what this week is for. Why is it important to maybe remember what OCD is all about and how this impacts people year round? I mean, because we should be thinking about it past this week, right?
Yeah, I think I specialize with OCD in children too, so I think some of it, along with the symptoms that Ann mentioned that we see in adults and kind of across the field, with kids, you might see kids not really presenting or talking about their symptoms because they might think that everybody kind of has these intrusive thoughts or, repetitive behaviors and things like that. So they might not know to speak up. So just kind of bringing awareness to what the kids struggle with, along with these other symptoms that Ann mentioned, could be helpful to kind of just bring awareness to that side of it as well and get early intervention.
Yeah, absolutely. Catch it early and also get help with that for your future.
Yeah, now how can we identify the difference between maybe everyday worries and everyday habits and OCD behavior?
The key is the debilitated effects of the day-to-day intrusive thoughts, images, and really what Jessica had mentioned is that there are a lot of struggles with, it's not just contamination, we hear, not just contamination and symmetry, things have to be just right. It's aggressive obsessions, it's contamination, sexual obsessions, relationship OCD is there too with relationships, being able to engage in relationships in a good way, and health and somatic fears as well can be there. And a lot of people don't know that those taboo things, religious obsessions that are also a part of those anxieties that come with OCD that are specific with OCD.
Yeah, you're talking about some of the misconceptions. Some people might think, oh, I need to have everything neat, or I need to have everything clean. You always hear the phrase, I'm very OCD about this scenario, right?
Yeah.
Can you detail some other misconceptions that people might have about OCD that you hear at the clinic or something like that people don't necessarily realize, oh, that is OCD?
Yeah, I think a lot of mental health in general can be on a spectrum, and so you might have these OCD tendencies, or you could identify with, oh yeah, I like to keep things orderly, or even, oh yeah, I'm a little bit superstitious here and there, but the big misconception would be how time-consuming is it, and how Ann was mentioning, will it impact your values? Does it take time away from your relationships and the things that matter to you? Is it taking sometimes hours, 6 to 8 hours out of your day to engage in these compulsive rituals and things like that? So I think there's a big difference between the trends on TikTok or other social media platforms where people might say, oh yeah, I identify with these, but really there's a difference between having some of those tendencies versus really having it impact your life.
Yeah. What would you say about people that need help? Often there is a stigma around getting help mental health help in general. What would you say to those folks that maybe say, oh, you know, I think I do have OCD, but I don't need to go and get help for it? Or maybe it's so debilitating that they do and they don't realize there is help. What would you say to those folks that don't realize that there is adequate mental health services available for them, especially when it comes to OCD?
Yeah, I would say one of the biggest reasons why I love working with OCD, and I've been doing it for 10 years now, is because I actually have OCD myself, and I understand how debilitating it can be. And but I also understand what it's like to come out of it, and even though I still struggle, I know how to manage it.
Yeah.
And that's the key, is that I'm able to engage in my values and the things that matter to me, despite the thoughts that come in. And you're not alone. I tell clients a lot, you are not alone, and oftentimes they have a hard time telling us what they experience or the thoughts that they have. And after they understand that we are not our thoughts, and that you are not your OCD, it's hugely freeing.
Yeah.
To know that.
Yeah, you mentioned you struggle with OCD. How does that help in helping treat patients with OCD? Does that help you in your own journey, or how does your own relationship with OCD help other patients as well?
Yeah, I think it just helps put us on a level where it's there's this understanding, and for the first time, being able for them to talk to somebody that has had it. They haven't really been able to verbalize a lot. And so when they're talking to somebody that says, hey, it's okay to have these thoughts. You are not your thoughts. You can be free from this. There's hope from this. There's something about that. Not that you have to have it to treat it.
Right.
But it definitely gives me an ability to come at a different level with them. And yeah, I love being able to help people through that.
Yeah, absolutely. We're kind of wrapping up our interview here, but I want to ask you, you know, if there is a place where people can get resources, where might that be? If someone is here at home struggling and listening to this interview, where can folks find help?
Well, I would say International OCD Foundation is the one that we are part of, and they have a resource directory for people that are looking for resources, medication providers that are specialized in assessment, diagnosis and treatment, and know the right treatment, which is exposure and response prevention. That's the key. Only CBT by itself can be harmful and feed into anxiety and the OCD. So exposure and response prevention, which is evidence-based treatment, is key to when you're looking for a provider. And Integrative Health Consultants, we have 16 providers on our team, our OCD team, that are all specialized and trained in working with children, adolescents, and adults.
Okay. Well, Ann and Jessica, we appreciate your time. Thank you so much for sharing why it's important to acknowledge OCD during this week and year-round as well. So
Thank you.
Thank you so much for sharing that. We appreciate it.
Thank you so much.
Thank you.
Thank you guys for being here.